I think we're a few people, so until we start with the session, we can just start with the introductions, like whoever is present here. Many of them might be from NIHS, some from outside. So if you'd like to introduce yourself, if you feel comfortable.
So I guess I'll start with myself and then you guys can go ahead. So hi everyone, I'm Rajshree Singh. I'm a first batch graduate from Nepalese Army Institute of Health Sciences, College of Medicine. And I graduated in 2018 and this year I matched into my dream specialty, diagnostic radiology at Mercy Catholic Medical Center, Darby, Pennsylvania. So the session today here is about me sharing my experience, and we have our wonderful moderator, Pratna. I guess you can go ahead and introduce yourself.
Thank you so much, Diju. So I'm Pratna, currently studying in 4th year at NIHS. I'm the 6th batch. So I entered school in 2016. So Rajshree Diju is there, I think, when I was there. So it is an opportunity to talk to you even after so many years. And thank you for always being so helpful and kind. And you're always someone who I look up to.
Thank you so much for your kind words, Pratna.
We're just doing the informal introduction before like the program starts. So this is not a formal program. So if anyone feels confident enough and not so shy, you can turn on your cameras as well.
Yes, absolutely. I think this is a really great chance for you to kind of break your shyness and enhance your communication skill. I was like you all before, but I'm slowly working on it and kind of improving my skills as well. So yeah, go ahead. This is a completely informal session and I'm really happy to answer your questions here today.
I think everyone is feeling shy.
It's okay. Shreksha, you can introduce yourself. I mean, you're the person behind all of this. So yeah, you deserve some recognition.
Hello. कसरी अफ गर्छ
See, this is why you should practice.
Hello everyone, I'm Freksha Khatka. I currently study in NIHS. I'm 5th batch. And and that's it.
So Shreksha is the one who reached out to me at first. So I had other couple of invitations as well, but I really had a soft spot for my own alma mater, NIHS. So yeah, I said yes to her. And she's the one who's kind of brought us all together over here. So yeah, thanks for that.
Shall we start? I think we should start formally now, like after. So whoever present here, I'd like to wish them all a very good afternoon. And I welcome you all to this event called The Road to Radiology with Dr.RadRashi Singh. This is a collaborative event by MedLife Stories and Alumni Association of NIHS. And I'd like to welcome Rajshree Diju. The introductions would not do justice because she's so inspiring to me and someone who I look up to. She has recently matched into her dream specialty, that is diagnostic radiology. And thank you so much, Diju, for agreeing to share your journey with us. And I'd like to welcome you. And since this is a question answer session, I'd like to begin with the first question is that USMLE from my first year of medical school, I know is a very hectic process. So you do the steps and there's the matching process, the interviews and stuff like that. So how does it feel after matching?
Hi, Pratna. Thank you so much for such an elaborate introduction. And I still don't think I kind of deserve that because I'm just kind of a couple of years senior to you all. And all of this has also been a very learning process for me. So thank you so much. How I feel about residency? Well, it's just such a surreal feeling after, graduating. I've been working on USMLE for almost 2 years now. So I'm kind of letting the whole, matching into residency feeling kind of sink in. I still feel like I have to go to reading room and kind of prepare for another exam. But I'm really excited to finally be able to implement what I've studied into my practice. So in this medical education, we have a really famous syndrome called imposter syndrome. And it's like having an internal experience of, having an intellectual phoniness. So I'm kind of feeling that for myself. And another thing I've realized after matching into radiology is that initially, for me, pursuing for radiology was my own personal ambition. But after getting matched, I've received just immense amount of outpouring numbers of wishes and messages. So I've kind of realized that I play a really small part in something really big. And this is like a collective triumph for visa requiring USMLE aspirants, and especially for you guys, my juniors from NIHs.
Yes, that's true. So whatever you do can have an impact for so many people and in so many people's lives. So you're only thinking about an individual while you're doing that, but what you've done, the repercussions are huge. You have also been a source of inspiration for your alma mater, that is the students from NIHs as well. So I'd like to thank you again. And starting with this, there are so many students from first year here as well, and many of us might have heard about the USMLE process and stuff like that, but would you like to briefly elaborate the timeline of USMLE, or how does the process go, so that our first year students also get to know what USMLE is?
Yes. So USMLE is a process for which we try to obtain medical license for practicing in the United States, doing an MD, or sometimes even going for fellowship. So that is what USMLE is. It's United States Medical Licensing Examination. So your main goal is to be ECFMG certified. ECFMG is a for-profit organization which looks after foreign medical graduates, and they kind of certify you in order to be eligible to sit for the residency interviews. So in order to be ECFMG certified, you need to complete 3 exams. So first one is step 1, and then comes, which is much more involved with the fundamentals of basic sciences. And then comes step 2. Step 2, initially it had 2 parts called a CK, clinical knowledge, and another part, clinical skills. Where you test the clinical skills and communication skills of the candidate. So step 2 CK is much more oriented with the clinical knowledge, as the name goes. And recently, since this year in 2020, step 2 CS has been replaced with another exam, which is also a standardized exam called OET, or Occupational English Test. And it is pretty much similar to your previous step to CS. Only difference is in step to CS, you had to go to United States to give the exam, but in OET, you can give it from your home country as well. So that you have to complete 3 exams in order to be certified, and then you can apply for interviews and then match into your desired program. So that's basically what USMLE's basic processes. So I made up my mind to pursue somewhere around my 3rd year, but I actually finally took initiative to actually work on it through starting my internship. But it was difficult for me to start during my internship So I was kind of doing my own mental homework in my internship because, as you all know, working in the military hospital is quite rigorous, and especially when you're first batch, or more famously, the resident batch. So we had to almost work for 96 hours a day, a week. So we couldn't really, go back home and study. So I was busy kind of collecting materials, taking advice, and kind of preparing my timeline. So I graduated in 2018, and I have had my fair share of highs and lows trying to balance work and study because I was also working, trying to save up some money because USMLE exams are quite expensive and you have to save up a lot. But I saw it as a good way of a good investment for my future. So yeah, I was saving up for it while I was working for an INGO. So on an average, a candidate would take 1.5 years to kind of certify yourself for ECFMG. So if we take an instance for the TU board, we finish our internship during February. So the best timeline would be to kind of give your step 1 in December, take a couple of 6 to 7 months to kind of prepare, and then take your CK in somewhere in the next 5 months, like in May, and probably take your OET in another couple of weeks, like in April or June. So that way you could like complete all your 3 exams and be CFMG certified. Sometimes taking certification can be a long process too. It might take up to a month. So your main goal is to be certified prior to mid-September. For this year, it was extended until mid-October, but kind of keep a tentative timeline for being certified by the next September after you graduate. So that would be a basic process.
So this was just a review of what USMLE looks like, and hope our juniors from first got the overview. So talking about step 1, that's the first exam that you take, and it can be so overwhelming because we have been hearing about USMLE steps exam from high school, I think, when we decided to enter med school. It's a long exam and you need to take the whole day. So what was your internal feeling during that exam, and how do we take the date? What was the way we get into the step 1 process?
Right. So in my opinion, step 1 has to be the toughest exam among the 3 exams. And I think it is the foundation. Like you've studied basic science quite long ago, and honestly, our level of basic science is still doesn't cover all the content as compared to what step 1 curriculum is about. So I had trouble understanding, and I had to revise a couple of concepts, especially related to molecular biology, biochemistry, and genetics, and neuroanatomy. So I was someone who kind of pushed back my step 1. I shouldn't have done that. Now that I look back, kind of delayed my whole timeline. But what I would suggest you all is try to study standardized books and international books, which would obviously help you during your step 1 preparation later on as well. And this is my advice for all the students of first year and second year who are studying in basic sciences. Just go for the big books. I mean, don't be shy. And it's the best that if you could incorporate the both books, that is what I used to do. For example, for pathology, I used to study from Robbins, but sometimes I used to make notes from Harsh Mohan just for the sake of exams, because you can't always put everything that you know on the paper, right? So those are the little things that you can do starting your med school, which would eventually help you for your step 1. So step 1 is the most toughest exam, but if you kind of solidify your concepts during step 1, then CK is going to be super easy, and so will the step 3 be for you.
So thank you, Vichu. So moving on to more important questions that we all have as we move through medical journey. We always have heard the disparities that IMGs face while matching into US than the US medical graduates. And So one thing that we tend to focus on is research and publication and stuff. So everyone has told us that the more publications you have, the more chance of getting into a specialty. So how important do you think is research in our medical school? Did you start research in the medical school or after graduating from medical school? And do you think a specialty focused research is necessary, or you can do research in general topics of your interest?
Right. So yes, I think now that the step one is about to convert into pass-fail system, shifting from its previous scoring system, I think the other components of the CV, like your research experiences and your publication and your US clinical rotations, so everything now plays a much more vital role as compared to the previous mainstream way, where we used to focus a lot more on the scores. So research, yes, it plays a big role, but if you are a research oriented person and you have a decent amount of research already in your CV, then I would recommend you to kind of diversify your CV and add other things into your CV. So I'm going to talk a lot about your application a little later on in this session as well. But by showing other things in your CV, I mean trying to show your leadership skills, your communication skills, your interpersonal skills. So those are the things that you can also focus on during your application if you have a quite decent amount of research. And by research, it doesn't always mean that you have to put the number of publications, because sometimes you have to look out for publications that put a good impact on medical fraternity, something that's useful to your day-to-day practice. So you might want to start working on those. And definitely there are different tiers of research. There is much more easier ones like case reports and cross-sectional studies. You can start with those and later go up to meta-analysis and clinical trials. So obviously the bigger the kind of research, the better. The more you do the clinical, you try to involve in yourself in clinical trials, is much more better. So that's something that you should look forward in the long term. But the quality of research and the place where you put your publication is also something that's important. Like you would want to go with something that's PubMed indexed or other good or has good index or good impact factors like Web of Sciences. So you might want to focus on that as well. And another thing about research is sometimes it's not just the publication that matters. You could also always volunteer as working for journals as an assistant editor or just a reviewer, and that would count as a good exposure as well. So research definitely adds a good angle to your CV, and you should work on it. And yes, as you rightly said, Pratna, working in the medical school is something that's something that you should definitely do, because at this point of the time, you are pretty close to a hospital. You can work with your peers and study at the same time, because third year and fourth year are comparatively a little easier years of your med school. So I did the same. I was working on publication during my third year of the medical school, and I was also working during my internship, because internship is a period of your life where you are exposed to a lot of patients. So you can catch good case reports and kind of build a good rapport with your patients and kind of collect data. So those are really good time periods of your life where you can initially work on research. And that's what I did. And towards my application time, I was working on bigger materials like systematic review and meta-analysis. So yeah, I would encourage everyone to try your hand in research. And it's okay if you're not a research oriented person, and if you would want to, dedicate yourself to being a primary care provider and interacting with patients, that's good as well. And you can find other means to diversify your CV, but definitely you should add layers into your CV through these kind of experiences.
Yes, so we have already heard about the step 2 CS being it's gone. So there's OET, the step one being converted into a pass fail. So there's a lot of anxiety in us. And US clinical experience is something which is focused on for IMGs a lot. And there are two types, as far as I'm aware, the externships and the observerships. So which do you think holds much of an importance, or what is the better time to get an externship or an observership? And how can a medical student get into externship? And if not externship, and observership? And also, what did you do to get a US clinical experience?
Right. So as I was mentioning before, US clinical rotations are very important. And actually, there are three kinds of experiences that you can go for. First is the electives, which is the topmost priority. And this is something that only students can get, and graduates are not eligible to apply for electives. And then comes externship. So externship is something that if you are a graduate and you would want to do a hands-on rotation, that's what an externship is about. And then comes observership, where observership is like a clinical shadowing, where you don't get hands-on experience with the patient, and you are a graduate. So those are the three tiers of US clinical rotation, and electives are the topmost ones. And then comes the externship, and then comes the observership. So as a medical student, you should definitely try to get a elective. And internships are usually the best time to go for an elective. As for me, I would have definitely wanted to go for an elective, but being the senior most of my family and not knowing a lot about USMLE step one, I didn't know if I was going to score, if I was going to fail or something. And I was too scared to kind of risk all my investment and saving to, go for an elective in US and stay there for a couple of weeks and do one. But if you're not thinking about all those factors, then definitely you should go for an elective, because that's the gold standard. And I did externships, and it really helped me for my step 2 CS. And I did an externship in a clinic prior to my CS, and that kind of helped me get comfortable with the patients, because like, how you guys were very shy at the beginning to kind of introduce yourself. I was the same, interacting with American patients. So yeah, it was a really icebreaker for me, and I kind of got comfortable talking to them, kind of improved my communication skill, and that really helped me for my CS. So, and I think it would do the same for the OET as well. So externship was a really good exposure for me. And I think it really looks good on your CV to have these kind of rotations as well, because one, then you are kind of, trying to tell the program that, hey, I know how your system works and I have been familiar to this. So when I go into residency, it's going to be very easy for me to kind of catch up things really quickly. So that's what it's going to tell. And another thing is kind of securing a good, strong letter of recommendation that's very personalized. And so you could collect American letter of recommendations. And definitely when you are applying for an American program, then if you put up a letter from Nepal, they might not know the institution, and they wouldn't know the weight of the letter recommendation that you put forward with. And having an American letter recommendation, they feel very familiar, because they know that this letter is coming from someone who's a part of the system that they are in. So American letter of recommendations hold much more weightage than the Nepali letter of recommendation. So you'd be able to secure letter of recommendations as well. So I did both observerships and externships. I wish I did an elective. So I would definitely suggest my juniors that if you can go for elective, then definitely you should. And I would want to touch up a little bit upon how you can get the clinical rotations, and how I did was. I used a very traditional method. I went to webs. I went to internet, I kind of searched it up, made my own Excel sheet, and kind of output on all the information of the GME section and their email address, and kind of went on emailing them my basic CV and my score reports, and I just kind of emailed everywhere. And I was able to secure a lot of observerships to that way. And another thing, what you can do is you can definitely try to reach out through your contacts who are already practicing there. If their hospital policies kind of allow to have students under them, then that's going to be really good for you. So you're kind of taking a shortcut method, and you're already familiar with someone in the system, and it's a lot easier to do it through that way. Another way how you can try to get a US clinical rotation is through going through the forums. You have multiple observerships and externship brokers. There are a couple of names you would find in the forum, and they will charge you a certain amount of fee, and they will hook you up with people who would be able to take you under their guidance. So those are the three basic ways how you can apply for US clinical experiences.
I think that was very informative for someone who has not undergone an externship or an observership. And me in med school, I definitely try to get an elective, thinking about all of the factors that come into play. So hope, let's see. And I encourage all the medical students here to consider that too. So before we go into all of the intricate details of the interview process, what do you think it takes to match into the residency of your choice?
Right. So matching into residency of your choice is everyone's dream come true, right? And you know how you introduced me about me matching into my dream specialty. It was a big deal. And as you rightly suggested initially, while we were talking about research about how you would want to do your own interested specialty focused research. So those are the little factors that would help you kind of matching into your dream choice. Having a focused CV. So having good score is the backbone of your application, because it's going to help you not get filtered out by programs. Because once you're an IMG, you have to be much more better and much more competitive than your peers, because there's a limited amount of quota, and you all are competing for it. So having a good score definitely helps you kind of help them reassure that, hey, I'm going to pass your board exams. Hey, I'm really sharp and I've got this. So, and it'll help you to not get filtered out through the application system. So scores are a really good, very important component. Followed by that comes a really specialty focused CV, and having a specialty focused CV is much more important in specialties like neurology, radiology, anesthesia. So those are the specialties where you would want to put forward a very specialty focus, and you can show this focus through the research that you do and the US clinical experiences that you do. So I had rotation that unfortunately got canceled in radiology. So they kind of knew that, that I was really interested into this. And I was also working on a couple of research related to radiology. So that kind of hinted them that, yeah, I mean, like, she's not just taking chance, and she's not just applying widely and just like gambling my way into it. And she's like really interested in this because the programs are eventually very worried that what if the resident kind of changes their mind and they're not very passionate about it, then they would not give their 100%. So you would really want to show your passion. And another way how you can show your true passion, and which worked for me as well, is through your personal statement, which is another very important component of your application. And I kind of poured my heart into my personal statement, and that kind of worked for me.
So this is a portion that I wanted to incorporate, and much of the unanswered question could be found here. And it's about the dreaded interview process. So we have always heard that IMGs get lesser number of interviews than they apply to. And the process itself is so hectic that you're interacting with people from outside your country who you're not familiar with. many things come into play. So how was your interview process? And I'd also like to ask you, what are the common questions that are asked, and how do you stand out in your interview?
Right. So yes, having a good score and having a good application is only as good as you getting an interview invite from the program. Once you get an interview invite from your program, having a 260 or 240, you all are in a common ground. So it's during that interview you have to stand out in order to match. And when a program calls for interview, they're usually calling in a ratio of around 1 is to 20 or 1 is to 30. In my case, it was 1 is to 30. So in my program, there were 2 spots and they had 60 invited interview applicants. And during my interview day as well, I was very intimidated by my AMG and US IMG peers, and even my non-US IMG peers. They came from really intense and experienced background. They were working as research fellows in big shot hospitals. So it was quite an intimidating environment. But I kind of stayed original. I stayed true to myself, and I kind of was able to deliver that. This season, I had around 20 plus interviews, and I took a chance, and I rejected a pre-match offer. And a lot of people would say, like, why would you do that if you weren't planning to take a pre-match? Why apply for one? But hey, I didn't know that I would get a 20 plus interview invite, right? So you have to take that calculated risk. So sometimes applying smartly also kind of increases your chance of getting more amount of interviews. I wouldn't apply to a top tier program, a super top tier program, if they had very few IMGs, or like next to zero IMGs, or something like that. So you have to take a calculated practical risk and kind of have to thoroughly make a really comprehensive list of programs that you would want to apply to. So that kind of increases your chance of getting more number of interviews. And according to NRMP's stats, if you have something around 10 to 12 interviews, that kind of gives you a chance of matching almost 90%. But I have had a couple of friends who were not so fortunate, who weren't able to match with decent amount of interview invites as well. So that's where a good communication skill comes into play. And during this season, it has been emphasized a lot more that communication really matters, because now program is judging you virtually. They cannot see you as a 3D picture of you, the layers of personality that you have, a dimension, your body language, all of that is gone. So now communication skill plays much more important role. And the kind of questions that the program director asks you are very informal questions. So there are 3 or 4 categories of questions that you would ask. There would be generic questions that you would get in any kind of interviews. And then comes the ethical questions, where they would give you an example of a difficult situation, and you would have to kind of show how you would, handle that. So they're just trying to see your managerial organization and interpersonal skills, and judging you based on how you interpret and handle that kind of situation. So general questions would be like, hey, tell me about yourself. And you'd have to kind of make up a 90-second answer about who you are, where you come from, what are your interests. And this is the most important question. And I really worked hard on this one too, because this is the point where it would kind of steer the direction of your interview. Like, you talk about your hobbies during tell me about yourself, and then for the next 15 minutes both of you are just talking about hobbies. So this is like a deal breaker question. So this is the most important question that you should work on. And you should definitely work on the common ethical questions that you'd get, like tell me the time when you had to face a difficult situation, where you had to, where a patient was angry with you, or, where you disagreed with your supervisor. So those are the kind of questions that you have to prepare for. And I would be happy to provide you a list of questions later sometime. If anyone's interested, you guys can email me and I could drop in the question. So those are the questions that program directors and the interviewers would ask you.
So true. At the end of the program, you can drop in your email in the comment box as well. And one thing I'd like to ask is, as far as I learned from the podcast that I've heard or talked to people, you get to ask the question to the program director as well. So it isn't a one-way process, but rather a two-way process. So they want you and they want to see that you want them as well. And you need to be sure about that as well. So since we respect seniority a lot, asking program directors the question would be a very hard time typically for me. I'm speaking personally. So what do you ask to a program director or the program that you're entering into? So what would you ask and what did you ask?
Right. So yes, I come from a similar background where we are told to kind of agree to everything our supervisor says and not question them back, because that's a sign of disrespect. But things are a little different in the US, and I kind of like it that way too, because then you get to build much more stronger connections. So yes, asking program directors question is not just for the sake of asking. And you have to put forward relevant questions, because at the end, it's about matching, and you don't want to be disappointed with your choices and live with regret. So asking question really plays a vital role in kind of deciding your rank order list, because sometimes not all the information are available in websites or the brochures that the program give you. And sometimes even the residents during the meet greet sessions, they cannot answer all your questions. So you would want to put forward a question that really clears your concern. Because eventually, like you said, it's not just about, the program picking you, even you are picking the program, right? So you would want to clear all your doubts, and that's what I did as well. So as for me, since I'm a first batch grad, and I really missed out a little bit on mentoring. So yeah, I really would want to be in a close-knit personal, environment where I get a one-on-one mentoring. So that was one of the major prerequisites for me while I was going into a program. So if it was a really big program, with almost 50 residents, then I would ask them hey, what if I get lost in the crowd? How would you help me kind of stand out and take care of me? So that would be my question to them. Or if it is a program which really has a lot of high volume care, and for those kind of program, I would ask them about, research mentoring. If I would want to do some kind of big research, would I get to find a mentor? So those were the kind of questions that I would ask. So it really depends upon program basis. And sometimes I would just want to know that perception of my interviewer. I would ask them hey, what made you join the program? And kind of, just ask the question right back at them. So that kind of helped me understand, how the program makes their employees feel about them. So yeah, so you would find those kind of list of questions, but at the end, you kind of have to tailor it according to your personality and what you're looking out in that program.
So since the topic of mentorship came about, how did you create a rank list? Did you have any mentorship to help you do that, or did you do it on your own? How did you build up your rank list?
Yes, so there are a couple of dreadful moments in your USMLE journey where you need a lot of help and advice from your seniors. The first was kind of deciding when I take the exams and kind of making a general timeline of my USMLE. That's where I was seeking a lot of advice and guidance from my senior. Another was when I was applying for programs and application. and trying to weigh, because you have a limited amount of time and there are a couple of months and you have to also work on research and also work on clinical rotations, work on your personal statements. So you're kind of balancing everything. So they kind of help you kind of, kind of balance out everything to say like, hey, stop working on this, maybe you can work on that. So though that was another time when I was seeking a lot of help from my seniors. And another time when I was seeking help from my seniors was like trying to ask them if there is any way that they could recommend me to their program. And last but not least, when I was asking help from my seniors was doing my rank order list. And deciding the rank order list was one hell of a nightmare for me as well, because and especially because this year it was all virtual, and most of my perception about the program was based on my virtual experience during the interview day, the program brochures that they sent. So although I had an advantage in the sense that I was saving up a lot of money through travels, but I was missing out on a lot of things like the real-time experience of meeting people there, building actual human bonds and kind of feeling the place and the geography. So I was really strict about my priorities. So I got a lot of advice from my seniors as to how you would want to, decide your rank order list. And you get a lot of advice and it kind of confuses you. But my advice would be to kind of take all of that advice and at the end do what you think is the best for yourself and be happy about it. So there are people who would kind of formulate their rank order list based on the kind of visa, because sometimes going for H-1B versus J-1, they would want to go with, getting green card faster, kind of waiting on their timeline from going from residency to fellowship. So they would want to do that. Another way how people would want to do is, no, I really want to go into a big university. And usually universities would give you J1. So they would want to match into a university. And sometimes if as for this year as well, if you haven't given your step 3 by the April, I think, or March of prior to starting your residency, then you're not eligible to get an H-1B. So eventually you're going to get a J-1. So those are the factors that would play a role. Another factor that plays a role in deciding rank order list is the reputation of the program, or having a spouse in the program, or how couple friendly the program is. If you're deciding to kind of, bring your spouse who's also a medical doctor. So those are the things that will play a role. Another thing that plays a role is the geographical location. Some people would want to settle in East Coast. Some people would want to go down south in Florida and soak up the sun. So those are the things that people usually kind of think about when they're kind of deciding the rank order list. Another thing is family for a lot of people too. So if you have a family who's close by, then you'd want to probably rank a program that's there. So as for me, when I was deciding a rank order list, definitely it was a specialty. Radiologies were by default number one, regardless of everything else. Then came the geographical location and the reputation of the program and the kind of visa.
Thank you, Viju, for much of the inside information about the process as well. So you've already talked about what counts in your CV, and we would take it in much more detail later as well. But let's talk about the changes that USMLE has incorporated into its system. So what do you think Step 2 OET change, as well as the pass-fail change, would mean for IMGs like us?
Right. So this is like a double-edged sword, to be honest. The Step 2 versus OET change, and I think we'll talk about them in terms of pros and cons. So definitely the step 2 to OET change has made it a lot easier for a lot of applicants now that they don't have to deal with the visa issues and the financial constraints while applying for USMLE, because giving OET in your home country is much more economically feasible as compared to having to go to United States and give a CES. So now looking at this, then this means that all of this factor would collectively increase the number of applicants. But on an individual level, this also means a lot more competition because now there is a larger pool of applicants. But I think having an OET introduced instead of step to CS is actually a great benefit for IMGs, because we are already seeing an increasing trend of IMGs matching every year. So definitely it's going to help continue the same trend later in the future. So another major change, like you said, is about the step 1 process changing from scores to pass-fail system. So again, this also means that now the other components of the CV, like I mentioned before, would hold much more emphasis, like research and clinical experiences. So for future applicants who are medical students, who are planning to go for USMLE, you might want to kind of start working on other components of your CV from now. And I think another thing that would be helpful is to still work hard on your step 1 and kind of have a really strong concept, because this would eventually help you secure good scores in CK. And definitely CK is still a scoring system right now. And it's not just about passing your step 1. You'd still want to give your best because that's going to help you with your CK.
Thank you so much, Tichu, for the explanation. Moving on to the hot topic, I think it's the resources. So there's a overwhelming pool of resources that you get everywhere with the access to internet now and so many books to read from. What are the most economical as well as the most efficient way to use the resources that you get? And what did you personally do during your study period?
Right. So I'm going to break down the answers according to the exams. So I would start with step 1. I get a lot of questions from my juniors regarding, how to prepare for step 1, which is why I actually wrote an article on my website called USMLE Pearls. And I usually I kind of make them refer to that. So in my website, I've mentioned about how I used my first aid and kind of annotated everything on top of it and kind of shut down according to, different phases of my studying. So my resources for step 1 were first aid, UWorld, and Kaplan, Anki flashcards, and Boards and Beyond, and discussions with my peer. And question banks were UWorld, and assessment forms were UWSA and NBMEs. So I actually have my step. So I was kind of using my books to kind of help with my laptop. So I kind of have my first aid over here for you guys today. So this is the first aid. So my friends used to make fun of my first aid, saying that, well, this is from 2018 because I gave my exam in March 2019. So my friends used to infamously call my first aid as first aid 2025 because it had a lot more information, as you can rightly see. So this is my bookmark. So what I did with my first aid was I kind of had annotations like this with color codings. So I had yellows for UWorld and pink for, I think, Kaplan and Anki. So I used the different color codes for annotation and different colored pens for annotation. So initially, my first aid was thick, really super thick like this, but actually this is the actual width of the book. And then I kind of shedded it down towards the end of my exam because those were the concepts that I had already memorized and kind of put it inside my head. So kind of started shedding it down. And eventually I gave my first aid around 8 rounds of studying prior to giving my step 1. So that was how I kind of tackled my step one. That was my strategy. And you can find a detailed description of my step one prep in my website. So I'm currently working on the CK prep as well. And hopefully I'd be able to put that up soon. So for CK, I used first aid step one, UWorld, and kind of made my own notes from the UWorld. I was part of group discussions. I used Anki. I used a book called Mixap. So it is a book, a series of book that American residents kind of use during their residency training. And UpToDate. I relied heavily on UpToDate for my clinical knowledge. So I knew about this process of applying for application for scholarship for UpToDate because they give out a handful of UpToDate subscriptions, annual subscriptions. So I kind of wrote a long essay and I kind of got accepted and they kind of gave me a waiver. So usually an UpToDate would probably cost you something around $200 plus. And at that point I was a graduate. I wasn't affiliated to any institution. So definitely you can reach out for your library and see if they have an UpToDate subscription they would be able to give you, or if you're an independent person you can probably apply for scholarship just like how I did. But UpToDate was really helpful for me to kind of understand the American latest guidelines and kind of clear out concepts which I had confusion with while I was studying for UWorld. And I also use Amboss. It's also another paid QBank, and I used Amboss for my CK as well. And for CS, I think now what I used for CS is quite irrelevant, but I would still go out mentioning anyway. So I kind of use their website videos, and I practice with American peers and peers from all around the world during my CS, and that kind of helped me because I think with the USMLE, it's all about stepping out of your comfort zone, and that's what I did. So I was meeting new people, kind of get comfortable talking to them, and that kind of helped me with my communication skill and clinical skills in this case as well. And lastly, for step 3, I didn't mention a lot about step 3 initially, so I'd mention it right now. So step 3 is an exam, which is an exam that most of the American graduates would give prior to their residency training or during their residency training. And for visa requiring applicants, step 3 is important in order to qualify for H-1B visa. So I gave my step 3 prior to my interview season because I really wanted to be over. And I thought that maybe I'll start forgetting everything from my CK if I don't give my step 3 ahead. So that's what I did. And for step 3, I kind of revised my step 1 and my CK, used the same resources. In this case, I used my own handwritten notes from CK and first aid from step 1. And I took a subscription of UWorld, and my self-assessment form was UWSA. So it's a 2-day exam as compared to step 1 and CK, which is a 1-day exam. So yeah, those were my basic resources. I'm pretty sure I'm forgetting a lot of things here and there, but forums are very helpful as well. So do check them out.
And it's quite intimidating as well as exciting to hear that it's not just the outcome that is the match, but the whole USMLE journey turns you into a different person, I think. So stepping out of your comfort zone, you're not the same once you match. And yes, many people are waiting to go on that journey as well. So the questions that I'd like to ask you is, after all this, what do you think is the ideal time for a person to start preparing? Or is there individual variations? Like if someone wants to give a step 1 in med school or step 2 CK first, then step 1. So what are your advice on that?
Right. As you rightly said, yeah. I mean, and it really kind of changes your perception. I wasn't like this if you had met me a year before or 2 years before, and it kind of really helped me grow as a human being. I learned a lot of stuffs about myself that I didn't know about, especially how resilient I was. And it was all about trying to push my limits and expand my horizon when I was trying to apply for USMLE. And talking about the ideal time as to when is the right time, the simple answer would be sooner the better. But at the same time, I am a firm believer of kind of balancing things. So I would definitely not want to jeopardize my ongoing medical education, because having accolades like gold medals, being a valedictorian or top of your class really helps you for your USMLE as well, because at the end of the day, you're studying and you're learning new information. And that is also a really important part of your CV to be good in your medical school academics, because they are checking out your transcripts as well. So if you are not jeopardizing your ongoing boards, then definitely you should start sooner the better. I would definitely suggest starting it during your internship. And it's a common trend in India as well. So you would want to start with your preparation. Just give it a couple of hours a day, every here and there, like a 2 hour or 1 hour, and then get into a full-fledged preparation after you graduate. So if going by that timeline, I think you'd be able to give your step one probably 4 months after graduation if you're really serious about it. But then again, I know people who dread a lot about NMCLEs as well. And NMCLE is an exam where unless you give that exam, you wouldn't know that, hey, that exam was not that bad. I mean, I would have passed. So talking about NMCLE, I think based on the statistics, I'm not saying it on an individual level. So based on the statistics, around 80 I think Nepali applicants who are starting from medical schools in Nepal, I think 80 to 90% of them pass. So if you think you're someone who belongs to the 80 to 90% of people, then you don't have to panic a lot about your NMCLE, and take your USMLE and your NMC preparation side by side, and kind of take them to during your internship. And I think now that there are residents and it's a lot more easier in our hospital, in our army hospital, you might be able to give a couple of extra hours to USMLE preparation as well. And that's something I deeply regret as well. I wouldn't have pushed my USMLE timeline had I been able to prepare a lot more earlier. So that's the kind of advice that I would want to give to my juniors. So you have a lot to do during your internship, and because you have to go for your electives, you have to start preparing for NMCLE and USMLE. I have put on a lot more responsibility and research, but I think the ideal is what fits best for you, right? Because you have to tailor it according to yourself. As for me, I really wanted to save up some money, and I really wanted a break after my finals, and I really wanted to soak up all that clinical learning. I was really excited to go there and do an appendectomy and put skin grafts, and I just came back home tired, and I didn't want to do anything, just to be there with my family and kind of, watch a movie or something. So it all depends on you. But there is something called year of graduation that you should be worried about. So there is an arbitrary filter. I wouldn't say it's a really strict filter that the earlier the graduation, the more chances of matching. So if you're someone who's about to hit that 5-year graduation, limit, then you should be worried, because applying for USMLE, Americans, they have a tendency to not put a lot of year gaps in their CV, and they're constantly like doing something. So if you're doing something that's substantial, like getting an MD degree and then going for USMLE, or you're taking an MPH course or something, then year of graduation doesn't play an important role. But if you're just like, hanging out and kind of being undecisive and trying to kind of decide what you want to do with your life while you're just working somewhere in a hospital, then that kind of thing on your CV with a year of graduation of more than 5 years would be something that I would be worried about. But at the same time, I wouldn't want you to rush And you have to kind of find your own pace as to what is your ideal timeline. But definitely sooner the better. And oh yeah, and you asked me about, how if you'd want to go for CK prior to step one. So there is a trend where you could give your CS earlier. I've seen candidates. It's not a very common way of kind of giving your USMLE in Nepal. Only few people have done that, but elsewhere, when I read it in the forum, people would apply for visa and go for the electives and also give the CS exams at the same time, and then come back and start studying for step one and CK. So that's what they would do. But now that you have OET and you only have a reason of, kind of going to US just to do your electives. So I would suggest you would want to go give your electives, then come back and start studying for step one and kind of give you a step one. And as for giving your CK before step one, I wouldn't advise that, because even though step one is a basic science exam, but it has questions that are problem-based questions, and you need to have a good understanding of those disease processes, which you would get a lot more information about those disease process during your third, fourth, and fifth year. So our curriculum, with our curriculum, I wouldn't advise you to give your step one after your basic sciences, because even though we have a lot of disease exposures earlier to our pathology lessons and everything, I don't think that's a lot enough for us to kind of tackle those problem-based questions from step one. You can do that, yes, of course, but you'd be compromising on your scores. But then again, there is exception to all of those kind of rules, right? So you wouldn't want a lot score, and you'd want to finish your exam sooner, or you would want to go for really good scores. So you just have to kind of find a fine tuning of things according to your own personal needs, and there is no hard and fast like right or wrong answer to a lot of approaches that you take.
So in the end, it was very, very good to know all of the inside processes of matching and stuff. And since USMLE isn't always about score and matching and stuff like that, it's about you turning into a whole person as well. So what are the advices that you like to give to your juniors regarding what person you should be once you graduate, as well as once you come out to the world, facing the real world? And since today you're here talking to your alma mater as well, what are the NAIHS memories that you think that you hold very close to your heart? And as well as what can we as NAIHS students do during our med school to incorporate and become a whole person, develop those relationships, and have a wonderful time during our journey in NAIHS?
I mean, there's a lot to talk about because definitely I would point you out things that I think I shouldn't have done, or I could have done better as compared to, how I did it. So I would definitely want to reflect on those decisions that I took and kind of tell you guys like, hey, don't do that. What I did was like completely wrong. So you might want to, not go the same path that I did. But there are a couple of things that I learned about myself, and I would want you to experience that as well. So there's a lot to talk about, and I can start with what you could do to like kind of prepare for USMLE at your level. So my first and foremost advice would be never say no to any opportunities, all while balancing your academics. Just take up everything that comes. Yeah, and that's what I did as well. And another thing is like, don't cram the topics, don't cram just for exams. Try to understand the topics and go to the concepts and kind of enjoy. You have to fall in love with medicine, and then only you can excel and actually develop true passion. And use good books right from the beginning of your medical school. Just do that, and you have to start working on other aspects of application as well, and not just for the sake of application, because medical school is not just about kind of becoming a human version of UpToDate or Medscape. And just don't try to be that person, and just try to find your interests outside of medicine with fields related to medicine, like research and volunteering. Do those kind of things, and all while you can also work on your own personal hobbies. And and start trying to build connection, reaching out to people, because that's how you kind of get, no one's going to come and spoon feed mentoring to you. You have to reach out to people and ask questions. So you have to definitely start doing that, and start planning your timeline. Just don't, like, you don't have to go it rigorously, but kind of just have a vague idea of what you want to do, when you plan to match, or do you want to save your money for exams, or when you plan to take on steps. You don't have to do everything and kind of rush towards it, but just have a timeline, and be faithful to your timeline. At least that's what I did. I wasn't faithful to my timeline initially, so I would definitely want you guys to do that. So life advices, let me just break it down. I mean, for third years, I would say have fun. Second year and first year are crazy. You're just kind of trying to just settle to this new normal. So just take a break during your third year. What I did during my third year was I wasn't focusing a lot on theory. I was very sincere during my 9 to 4 classes, but after my classes, I was like pretty chill. I was like doing a lot of new hobbies. I was into cosplaying, so it was just weird. I went to otaku conventions and stuff like that. That's what I did. But what I did during the third year, which was smart, was I was really focusing on bedsides. So I was there in bedsides. I was sincerely interacting with patients and kind of enhancing my clinical skills, and that kind of helped me during my final year boards. And fourth year, you'd have to kind of start preparing for final year also while preparing for fourth year. Just do that. Just like take handful of big topics of your final year. These are like the diseases of each system, like cardiac failure, respiratory failure, chronic kidney disease, the big short ones, the myocardial infarctions and strokes. Kind of just finish all those topics at the beginning of your fourth year, also while working on the fourth year subjects. And that's what I did. And kind of start kind of deciding for yourself as where do you see yourself in the next 5 to 10 years. And now that you're exposed to all the medical subspecialties, I think this is a really good time for you to kind of make up your mind as to, what do you want to be in the future, right? So fourth year is an optimum time to kind of decide that. And final year, I think for the 6-7 months, you're not going to be able to do anything but just study and do that and ace your finals, do it. And and internship is the most crucial time. This is a really interesting time because this is where you want to kind of relax now after your finals. But at the same time, you have to start kind of bridging your way into your MD or MS. So it's about finding that balance as well. Internship is a very active time of your life, and definitely, I mean, you could work on, kind of deciding where you want to go for USMLE or PLAB or whatever is that you want. Talking about my NAHS memories, I think there are a lot of NAHS amazing memories. Something that I would have to name it at top of my head would be, watching movies after our end of library time, which is around like 10:30 p.m. for us. So I used to come back to my hostel room, and my group was like infamously called Star. So that wasn't the name that we gave. So we were given that name. So coming back to hostel room with Star and kind of watching a nice chick flick was one of the most fun time memory for me. And another most memorable moment in my NAHS was the spark in my parents' eyes that I saw during the annual day when I won the Best Student Award twice in a row. So those are the couple of moments that I would cherish forever in my life. And talking about how to utilize your time in NAHS. I would like to share this interesting story about myself. So prior to joining med school, I was kind of confused if I would want to go for med school or I wouldn't want to go for music. I know it's just like polar opposites. It's not even I'm thinking about, going for something other than science. So I was really interested in music. So prior to joining med school, I was working as a music journalist for an organization, and I was also part of an event management company. So I got to interact with a lot of people. I met foreign musicians and kind of develop my organization skill, leadership skills, and eventually I ended up going for medicine because my dad kind of swayed me after working as his scribe since grade 7 and his little assistant slash little pharmacist. So that's where I eventually went. But this experience really helped me in the long term to become who I am. So no opportunity in your life would ever go into waste. So it's going to eventually help you shape your personality and become who you are. So just be a person with dimension. Don't just be a person who is there, who studies, who gets good grades, and and plans to do MD or MS. And by having dimension, it also means trying to be compassionate about your patients and really being there, going an extra way to kind of help them. That is also a way where you can develop personality. It doesn't have to be doing something that's like out of the box. It can be something as little as kind of doing nice social work or volunteering somewhere. So those are the things that would help you kind of shape yourself and understand who you are. But also at the same time, those are the things that you would put on your application, on your CV, and kind of define who you are. And I would definitely not suggest you kind of fabricating things on your application, because these interviewers are the people who are very smart and they have years of experience and who have been doing this for a very long time. And they can eventually spot people who aren't what they are as they look on their resume, right? So you would want to actually experience those things real time and kind of feel it. And they would be able to see that once they interact with you in person. So yeah, that would be a very important piece of advice for me, to just try to get the maximum experience, whatever it may be, through any means that you can. And this is eventually going to help you shape who you are. But at the same time, it's also going to help you understand that what makes you truly happy. And that's something that's very important, because at a lot of times we all are going through a herd mentality, that we see someone doing something and we kind of want to do that thing. But no, I think you should really tailor your dreams according to your own needs and not try to copy someone, because something that worked for someone might not work for you. And you don't have to do it just because you think that's the gold standard. There's nothing called gold standard. It's something that's truly making you happy is what you should eventually seek out for. And yeah, and you would only know if what makes you happy unless you kind of experience everything around you, right? So now that my CV kind of looks all over the place, because I have been doing a couple of things. I play bass. I love belly dancing, and that's not even relevant. And I advocated for more palatable mess food during my med school days. And I was the valedictorian. So my CV looks all over the place. But having explored the multiple aspects of medical science and the opportunities, I think I will never have to think that, hey, what if I chose option B instead of option A? Because I've explored both the options, right? A and B. So now that I'm here, I know like this is what I truly want, and this is where I belong. So I think my juniors, you guys should do the same too. Try to explore things and just be sure of what you're doing, because you can only be passionate about what you want to do unless you're like very sure, like, yeah, I know this is what makes me happy and I want to work really hard to kind of get that. So that's how your zeal comes in life. So yeah, and seek guidance from your seniors, ask their opinions. They're a very valuable thing, and reach out to them. And another thing that I would want to advise you is like, take chances in your life, take calculated risks. Like my dad used to tell me, if you don't apply, you have 0% of getting that. But if you kind of apply, you might have at least 2% chance of getting that thing, right? So and that is kind of the thing that kind of sets you apart. That is where, you know, uh, it, you kind of get the difference. And that's what I did, and I matched into radiology. So because contrary to the popular belief, not a lot of IMGs apply for really competitive specialty, but you never know unless you kind of give it a try, right? And just make the best out of your med school, enjoy your hostel days, and try to fall in love with medicine, because you're about to commit to something that is going to be your identity for the rest of your life. And definitely you don't want to live with, regrets or be conflicted about decisions, your own decisions.
Thank you so much, Tichu. It was wonderful interacting with you and talking with you. So we'll have a Q&A session as well. But the biggest takeaway point for me has been that I'm a very philosophical person as well. So you have your own uniqueness. So regarding the conventions of whatever you're told, like what you need to do, there's always a unique spark that each of us emits. So I think we need to leave them everywhere we go. And thank you for reminding us that as well. And going with the questions, we have a couple of questions that we got from Facebook Live as well and through Zoom. So the first common question that we got was, where did you work? I don't know, like, do they mean in their internships or after graduating from med school? So if you could.
Right. So initially when I was working for an international non-governmental organization called Helping Babies Breathe. So my job was to go around places and trying to teach rural midwives and nurses about neonatal resuscitation and managing postpartum hemorrhage. So that was the work that I did for 18 months. And the reason why I took this job was I was preparing for USMLE, and I wanted a job with a flexible timeline where I could like kind of decide when I would want to go to work. And most of my work was work from home kind of thing, where I was like tabulating data, or sometimes I could like collectively go out in the field and work. So this was the best job for me during my USMLE. So, and after that, I have worked in a lot of my own projects, where I was working as an assistant editor for a peer-reviewed journal, where I co-founded my own website because I absolutely love mentoring and teaching. And another job that I did was I was working as a e-learning developer, where my job was to create clinical content and questions and edit through the question banks for international ABIM, that's an American Board of Internal Medicine's board prep website. So those were the jobs that I was doing.
The other question is, I did not quite understand, but did you do any USCE during your med school?
Not during my medical school. As I mentioned before, I wish I had done an elective. I just didn't have the courage to go for it at that time. So I didn't do it during my medical school. I did it during my, visit to the US. That was after my CS. I did 3 rotations, and 3 of my other rotations got canceled, unfortunately, due to the COVID. So yeah, otherwise I would have done 6 clinical rotations.
So the other question is that, could you please suggest some IMG friendly radiology programs, especially for observership? And would you please tell the center in which you did your radiology observership, if you did one?
So I had planned my observership for Penn Medicine. That eventually got postponed twice and eventually got canceled. So it's a paid rotation. You can definitely apply for it. I think now, starting the September of 2021, they're going to do an in-person, and they have canceled the tele rotations. So not sure. You would definitely want to check out with them if they have made any changes in their policy. Another way where you could do is, I did get quotations through, you know, brokers who would kind of hook me up with those radiology observation programs. So you could definitely go out for them as well. I found it too costly for my budget at the beginning, so I didn't went out for them, but you can definitely try to reach out through them too. And another way is trying to, I got an offer, but I wasn't able to go and get a radiology rotation under one of my personal contacts, I would say, who's a radiologist. He would have taken me under his mentorship in the clinic, but I didn't have a visa at that time, so I couldn't say yes to that. Talking about radiology-friendly programs, you could find the list of programs in the FRIDA website when you're applying for application, and that would help you kind of decide which radiology programs you would want to apply to in the future.
So the other question is, could you please elaborate the pre-match process?
All right. So pre-match, there are a handful of programs that provide pre-match. And pre-match is a process where you get matched into a program outside the matching process. So matching process uses an algorithm called R3 system. So this is where the programs would put up the list of the candidates according to their priority, and you would put up your list according to your priority, and then the R3 system would try to connect you to your most favorable choice and their most favorable choice, and that's how the match process goes. So pre-match is a process where if a program invites you for an interview and they instantly like you, then they can offer you a residency spot on the table, or like in a couple of days or a couple of weeks, or how they would like it. So that is a pre-match process. So once you accept a pre-match offer, which would happen sometime before the match day, which is in March. So you would get an offer for a pre-match prior to your match, and then you would have to withdraw your name from the match. So that's what the pre-match is about. There are a handful of programs, mostly in the East Coast, that give pre-match offers.
So the other question is, as a medical officer, how difficult is it to manage job and preparation for STEP exam, and how did you manage to get the best out of it?
Yes, it's really difficult, but it also depends upon the kind of duty that you do. For me, starting during my step 1, I needed at least 12 to 14 hours a day of studying. That's what I did. And it kind of also depends upon the level of knowledge or where you're starting with and how early you started. If you had started during your internship, maybe you could have been able to balance more rigorous medical officer job and studying at the same time. But for me, I needed at least 12 hours of commitment every day to study. So I have usually seen my friends who are medical officers and also studying for step 1. They usually go for a part-time job, and that is something I would suggest for you to do as well if you plan to apply for match very soon. But if you don't have intentions to go for match, immediately, then you could probably do a job of a medical officer and then kind of take a break prior to your exams, like a 3 or 4 month break prior to your exams, and kind of sit down rigorously and study.
The other question that we have is, could you please tell us more about your radiology related researches or a letter of recommendations? And I think you've already talked about the observership.
So I had letter of recommendations for radiology. I had both Nepali and American letter of recommendations. And talking about research, I was able to participate in a couple of research as an assistant editor, and also none of my researches were published at the time. They were submitted, but I was working on radiology research.
Hope we can see them get published soon as well. Like
yes, I am kind of waiting to. So it's a research related to ultrasound findings.
Definitely waiting to read that, Pixel. And the other question is like, is there any specific study method or a process that you used or would you advise for effective retention and recall?
Right. So yes, I came from TU board and I was the last batch of ISC in St. Xavier's College. So I was the last of the last. And all my life, I had always been, giving answers in a subjective basis where I had to write long paras of answer. The longer the answer, more the score was what has been tackling multiple choice questions effectively as well. So that was a new experience for me. Talking about a good retention, initially I was the kind of a person who's like, well, I'm going to study this topic in depth, and I would take days or hours to kind of let it sink in, and then I won't forget this for the rest of my life, was my initial strategy during first year, but it didn't work out for me. And I realized something about memory is like the more you kind of reinforce, the more you kind of give a pulse basis of retention and kind of revise things again, the more it kind of goes into your long-term memory. So once I kind of understood the concept of reinforcing and doing a short dose prep, fast prep, but doing it much time and again, I was actually doing better in retaining those concepts. So I studied my first aid 8 times, but I used different supplementary tool in my first aid book. Every time I introduced a new kind of thing, but I was studying the first aid again and again. Because I studied the first aid 8 to 9 times, that's how I kind of retain things in the first aid. And I use flashcards. That is super helpful. So I used Anki flashcards. You can find the app in the Play Store, and you can download decks, and that was super helpful for me. And there was this test that Chesar did during our medical school, where he tried to identify what kind of learner you are, if you are a visual learner or you're audio learner or you're audio visual learner. So it turns out I was a visual learner. And again, once I figured that about myself, I realized that I don't do well studying paragraphs and text. So I started using illustrations into my own studying methods, and I made my own flowcharts and diagrams, and that kind of helped me retain the concept as well.
Thank you so much, Tiju. And I think there is one question now. For step 1 prep, is watching Board and Beyond videos over Kaplan lectures enough?
Oh, it's another heated thing, and I get that question a lot. So let me just answer this question in 2 ways. So choosing Boards and Beyond versus Kaplan depends upon 2 factors. 1, what is your level of knowledge? And 2, how much time do you have to kind of give it to, your step 1 prep. So how much knowledge do you have? If you think that, I'm not so strong with my basic sciences and I would want an in-depth review of everything, then you would go for Kaplan. And if you think like, well, I have to take my steps in the next 5 or 6 months, I need to finish up fast, then you would want to go with Boards and Beyonds. For me, I think if I would have to advise you, the best way is to kind of balance the both. So start with Boards and Beyonds. And if there's any topic that, the Boards and Beyond wasn't able to answer, or that wasn't enough for you, and you would want to know more about it, like in terms of genetics or neuroanatomy, then definitely you can only handpick those specific topics from Kaplan and kind of go in depth in Kaplan.
Thank you so much, Diju. It was wonderful time hearing your journey and actually learning so many things. Thank you for always being so helpful. I can't fail to mention this every time. So thank you so much. And I think we'll be able to take one question from participants here as well. So if anyone wants to unmute and ask Diju anything, then please feel free to do so. I think like everyone's shy again.
It's okay. I mean, you guys can definitely reach me out through my Facebook Messenger or email or anything works. So yeah, I mean, yeah, I love mentoring and guiding my juniors. And that's something I really missed out on being the first batch. And yeah, I would want to give out to you guys. And that's what the whole principle and our soul of alumni is all about, and kind of connecting the graduates with students. So yeah, don't hesitate to reach us out, and I would be even happy to connect you with people who you are interested and who are graduates as well through alumni. And Pratna, thank you so much for your kind words, and you did an amazing job moderating, and I had so much fun talking to you. This is probably our first session talking together. We have talked a couple times in chat, but I absolutely had a wonderful time talking to you today.
Thank you, Diju. It was wonderful interacting with you as well. And special thanks to Shiksha Diju for conceptualizing this whole event. So Diju, your final words, Shiksha Diju, if you have anything to say. If she's there.
I don't know. I think she's
it was very एकदम रमाइलो है होइन अनि thank you so much. This is
it's an absolute pleasure. Yeah, and thank you so much for inviting me, Friksha. You've put up a really good session, and I hope I was able to answer all the questions. So yeah, thanks so much again. And if there's anyone you would want to connect with in the future, then just let me know, and I would be happy to connect you through them, through the alumni as well.
Okay, thank you.
Diju, we did get a final question, so I think this will be the final question since the session has gone too long. So how did you get into the journal that you worked for, and was that helpful?
Yes. So how I got into the journal was I just applied to them. I emailed them. So another take-home advice for you all would be don't hesitate to email people. That's sometimes not all the opportunities are available online. So they were a very young journal. So I just said that, well, if you ever have a role of an assistant editor, then please take me in. And that's what it worked for me. And if it was helpful, yes, it was absolutely helpful. As a young budding researcher, reading more and more papers was very helpful for me. And that kind of helped me distinguish between good and bad papers and trying to read through the common mistakes people put on the paper. And that really helped me, get better at my own clinical research. And I had a training with the GNMA, which I did during my third year, and that kind of helped me kind of get this role of assistant editor.
So thank you so much, Diju. I think we've come to the end of a wonderful session. Hope everyone who took part got much more of a personal insight into what USMLE journey is about. And I think the biggest take-home message for me is to be a whole person and to be your unique self and to always grow and see what you can give out to this world. So thank you so much, Diju, again for coming, agreeing so readily. Thank you, Shiksha Diju, for conceptualizing this event. And thank you everyone who participated in this.
Thank you so much, Pratna, Shriksha, and a big shout out to Alumni and MedLife Stories.
So I think we shall end the session now.
All right. Have a great day, everyone.
Have a good day, everyone. Bye.